organ transplant as it might have actually happened. But they also found a statistician at Johns Hopkins who developed an algorithm, and anytime you can say algorithm on numbers, it's a win, for matching patients and organs through a histoimmune compatibility complex. And then probably most importantly, once the show was done and TV Guide puts the little blurb in, and members of the medical community saw that there was going to be an organ transplant, black market storyline. And these are never good for the organ transplant community because donors typically go away. They actually have done stats that if you do an organ show on television, less people get the pink stickers. Now, Hollywood Health and Society had read the script. They knew how we were going to end it. And they headed off the backlash before it even started and started a calling campaign to Leslie Moonves' office, no less, to say that, we've heard you've gotten a lot of calls for, but we know what the show's about. We think that there should be no question it should air and it will be a positive. So anyway, and then somewhere along the way I decided I wanted to crash an ambulance, which we didn't see in the clip. But that was another highlight for me. So.
Thanks. No, I'm sure the end did have a profound effect that you'll never know unless Sandra did a study on it. But certainly
increased donors signing up by 10%.
There you go. So it does have an effect. So if you were a showrunner, I don't know if you've given much thought to this, but just you could put on a story. What story about global health would you put on, or had you thought of any in the past that you just couldn't put on numbers? What would you do?
I think that, look, that's an impossible question to answer. Not only because the chances of me being a showrunner are so minuscule. But another episode that we did at Numbers, another one of my episodes was we did a bird flu, an avian flu episode. I'm kind of a medical junkie. I like this stuff. That's why I was the guy who's writing all of the medical storylines at Numbers. I probably frustrated. I probably should have taken more biology after 9th grade, because it really depends on the context of the show, because it's what you can get away with. Because to answer the question you asked Peter, do you have a responsibility? I don't think you do. I think you have a responsibility to be entertaining, because that's how you keep your job. So, but if through honoring that responsibility, you find an opportunity to do something bigger, and on 2 seasons on Numbers, it doesn't happen very often. So when you find that opportunity, I think that you do have a responsibility to take advantage of it. So,
but I do think you answered it in the sense that you found the article in the Christian Science Monitor that you thought was a cool article that can come out of any place, and you use that to tell the story. And then, of course, I disagree with him, because I do think we have a responsibility to tell things accurately on television, and that you can do it. And since I'm the moderator, I get to say it, that you can do it responsibly. And that's why I don't think about entertaining ever. Maybe because I've been really lucky to do ER and SVU. I never think about entertaining. I never think about the audience. I only think about the story. And I always felt that if the story was compelling, then you would be entertaining, and I didn't ever try to think about that. But those are the two sides that Sandra deals with all the time, in terms of, also I'm a doctor, so that influences me. And so it's a very interesting conundrum that we find in Hollywood. So I'm going to move on, though, and we can debate later.
No, I wouldn't take exception. Your shows are more highly rated than mine. So what do I know about entertainment?
Well, you're on Friday. So, Dr. Barat, tell us about malaria.
Well, I had offered to bring a video of my own, but they didn't want to see pictures of my vacation. So I don't have a video to show you. And fortunately, I guess Dr. Yamada stole most of my thunder. So let me fill in a few gaps, and then actually I'm going to talk to Peter and perhaps tell them a few real-life stories that I think are fairly compelling. Malaria causes anywhere from 1/4 to 500 million infections a year. It kills about 1 million people a year or more, mostly children under 5 years of age in Africa. That's the bad news. The good news is support for malaria has increased. When I started doing malaria back in 1995, the U.S. government was investing about $10 million a year. Now invests $500 million a year. There was no global fund. There is one now. The World Bank wasn't investing in malaria. They are now. And there are countries now that 5 years ago, a bed net cost $12, $25, and no one had them except the very rich. Now bed nets cost $5, and half the population of some countries are sleeping, or at least don't have a bed net in their house. Sometimes it's not hanging up, but that's the challenge we face. That's the background. Now, malaria, to take it back to into this country, because that's, I think, what both my previous speakers were alluding to. There are about 1,000 to 2,000 cases of malaria diagnosed each year in this country. Now, that may seem like a lot, but what that translates into is that most physicians will never see a case of malaria in their whole career. And probably most of those 2,000 are probably taken care of by less than 100 physicians, mostly infectious disease experts. And because of that, you often see rather bizarre ways that these cases are diagnosed. Things like when some malaria being diagnosed with a bone marrow biopsy, which is a rather invasive procedure where they drill into your hip or your sternum and take out a piece of bone marrow. It's a frequently done test when someone has a fever of unknown origin. Now, malaria can be diagnosed by simple finger stick, blood slide, look under a microscope, see the parasites there. But because they didn't often ask if the person had traveled, because they didn't do that simple blood test, they do the $1 million workup and including the bone marrow biopsy. So, and one case in particular I think has always stuck with me. It was a case that I was involved in when I was at CDC, and it was a case in New York. It was two kids who a mother brought her two children, 6 and 8 years old, into a private medical doctor's office. She told them very specifically they had been running fevers. We've just come back from Nigeria. I'm worried they have malaria. Private medical doctor said, it's the flu. It's not malaria. Don't worry about it. Gave them some cough medicine and a few other things and sent them home. 2 days later, the two kids were in the emergency room at one of the city hospitals in New York, and they were both comatose. Both children were comatose. And this is one of the signs of severe malaria. Basically, even in this country, about 40% of those people will die. Now, in the mid-90s was around the time when there was a lot of news about Ebola. And an overzealous administrator heard about these comatose kids with fever, and they were bleeding a little bit, and she proceeded to lock the emergency room from the outside so that everybody in the emergency room was locked in. They went through, the whole process of irradiating the blood, but no one actually bothered to listen to the mother, and no one actually bothered to look at the blood smear. And one of these kids unfortunately died. The other one fortunately survived. But, for lack of simply asking a couple of questions and doing a test that costs about $1 to do, these kids would have been fine. So just to bring that home. So, there are there are interesting stories to be told. We've had cases of malaria that were transmitted by blood transfusion, even organ transplantation. So it does pop up. These very common diseases in other parts of the world, when they're here, often appear in very uncommon situations.
Thank you.
Chicago.
Terrible hotbed of malaria. Not that long ago.
Well, malaria was transmitted in the United States. Well, in fact, it's still transmitted in the United States. We do see it was transmitted year to year up until the 1950s when transmission was interrupted. But we do see often in the summer months, not every year, but every couple of years, we see cases of malaria in people who have never traveled outside, never gotten a blood transfusion, never have any of the risk factors for getting malaria, and often live in areas with high concentrations of migrant workers. We've seen this. I've personally investigated cases in southern Michigan, in Florida. There were actually 2 large outbreaks in North County, San Diego, back in the early 90s, where more than 20 people over 2 successive summers were getting malaria. So the mosquitoes are here, and it's capable of being transmitted here. So even though we think it's not a problem, it can be a problem. And it's why I can't give blood, because I go to Mozambique, actually. And I go to, will probably never be able, if I continue to do this work, to be able to give blood, because you have to wait 2 years after you get back.
If you
Thank
read,
you.
I may just add, perhaps, if you read the Lewis and Clark journals, basically everybody has malaria all summer long, going up the Missouri River.
So in the interest of time, we'll move on, but I did see Peter light up when you said that the ER was in lockdown. So
I was actually amused by this idea that you could get malaria through a organ transplant, because if we wrote that story, then we'd save the lives of the people knowing about malaria, but more people would die because fewer people would give their organs.
Yeah, probably
So
not.
it's just a wash.
I know some people who
always-
can help with that.
Right. It's a conundrum, but I think the salient point is that there are lots of ways into just from those few real stories into telling a story about malaria. So now, Dr. Rutherford, please.
So when you actually said lockdown, I heard Lucknow, which is the capital of Uttar Pradesh. Shows you what the world I live in is. But yeah, I was in Namibia all last week, and where the prevalence of HIV in 15 to 24-year-old women has fallen precipitously from, 25%, 30% to about 8% in a single year, coincident with the massive rollout of antiretrovirals. And we think we may actually be seeing sort of a suppression of viral levels at a community level that has caused us to fall. So the point I'm going to make about AIDS is that, so as you all know, AIDS is a disease probably of chimpanzees that was transmitted into humans in the 1920s, early 1930s from people capturing chimpanzees and butchering them. So it's a blood-to-blood transfusion. Bushmeat, yep. Still can get it in the markets in Bangui. It probably hugely amplified by a French campaign to eradicate sleeping sickness through injections in the 30s with the building of the railroad from what was then Leopoldville, now Kinshasa, to Pointe-Noire in the Congo. So there's a lot of kind of sort of human hand playing in all of this.
How did that increase the?
Because they were giving injections, so it's immediate reuse.
Dirty needles, right?
Dirty needles.
But what those stories of HIV are now are really kind of these stories of Lazarus. People rising from the grave. And I was reminded, as Dr. Yamada was talking, that when I was a chief resident in pediatrics just down in San Diego at the Children's Hospital, 8 beds, 6 of them were filled up at any given time with children with severe complications of Haemophilus influenzae meningitis. We have a vaccine now. You go to Oakland Children's Hospital, where my wife's the chief of the ER. None of the infectious disease fellows, let alone any of the residents, have ever seen a single case. It just vanished off the face of the earth. However, it only vanished off the face of the earth in the developed world, and it's totally rampantly epidemic in the developed